University, the voice of Reichman University.
I teach mindfulness. I'm interested in psychedelics. And so I have also this unconventional side, which I find this synergy give me a lot of opportunities to merge those fields and to be in an influential place, also in the army, but also here in hospital that I manage this department, and then I can bring into the institutional Ministry of Health hospital things like psychedelic therapy and Zen meditation. It's not very usual that I don't think we have another psychiatrist in the hospital who have a Buddha on the wall.
Welcome to Raw, a podcast where we confront the complexities of war from the inside out. I'm Anouk, a journalist, author, yoga teacher, and meditation practitioner. Raw, or war spelled backwards, symbolizes how many of us feel in the face of the Israel-Gaza conflict, exposed, vulnerable, and seeking understanding. Here, we don't just discuss the external battles, but dive deep into our internal struggles, examining how this violence has shaken our very core. Join me in conversations with philosophers, psychologists, and spiritual leaders as we explore how to navigate these painful times with wisdom and resilience, finding guidance for our own paths through this raw, unfiltered world. In the year since October 7th, an unprecedented wave of trauma has deeply affected the Israeli psyche. 1 year later, I'm honored to welcome an extraordinary guest, Oded Arbel, a leading psychiatrist who has intensified his efforts to help soldiers and citizens heal from trauma since that fateful day. Oded manages the Gevim daycare unit at the Sheva Mental Health Center, where he treats complex cases of anxiety, depression, and trauma. He's also the head psychiatrist for the Israeli army and for soldiers returning from Gaza. Our conversation dives into his unique approach to mental health care, which seamlessly integrates traditional psychotherapy with meditation practices. He opens up about his personal meditation journey and how he guides both patients and medical staff through these techniques to foster mental resilience. We explore his pioneering work with psychedelics and clinical research, pushing the boundaries of therapeutic treatment. He also shares insights on what he believes is crucial for Israelis to cope with the ongoing challenges and trauma they face. With a rich background that includes teaching Buddhist mindfulness, holding a black belt in martial arts, and a passion for diving, his perspective is as holistic as it is grounded. Join us for this enlightening conversation about healing, resilience, and the intersection of body, mind, and spirit. Oded, good morning. Welcome.
Thank you for inviting me.
Thank you for agreeing to come onto this show. Let's go a little bit backwards to October 7th. Is that the time when you decided to go back in reserve duty? How did that come about? And how has it changed your life since?
Well, until I think it was called Chomat Magen, it was maybe about 15 years ago. I was already a doctor, but I was still serving in a combat unit.
That's during Operation Defensive Shield.
Yeah. I was still a combat officer. After that, I was kind of, I won't say fully post-traumatic, but it was hard for me to be a doctor and to practice Zen and to be so attuned to other people's well-being, and to also be involved in fighting. And I started serving in the army as a major, as a psychiatrist. And I became the head of this unit of the Gaza division, which treats soldiers injured mentally by the war. So I've been doing that for the last at least 15 years in all the war rounds in Gaza. So it's not the first time, and I have gathered quite a lot of experience in treating soldiers. And that's also my daily life here in the hospital, with which I treat trauma. Has its different aspects, but it's a field of my interest and profession. So it was quite obvious when the war started that I'm going to be called, and we just drove there like many other officers. And among with my colleagues, we started treating soldiers and people who were exposed to the horrors of that day. And in a way, that day continues, because people come again and again because they are not healed, because of the impact of the trauma. And war continues, and war creates more and more post-traumatic soldiers. So there's a lot of work in this field. And in a way, I'm 50 this year. And I think my professional life and my Zen experience and my training in mindfulness and my experiences as a combat officer and my experience as a military psychiatrist all made me, I wouldn't say ready, but maybe more apt for this task, which never stopped being difficult and hard, also on the therapist's souls.
Give me kind of like a macro perspective for a moment of the state of soldiers in the army and the kind of general population that you meet that is dealing with trauma. How would you describe it at the moment versus before October 7th?
Well, I think basically the most obvious part is the numbers, the statistics. Many, many, many soldiers suffers from post-trauma and moral injury, and are exposed to horrors. So the big and first and most prominent difference is the number of people who are casualties, mental, psychiatrically casualties of this war. And it stands also for civilians, of course, which I see in hospital and in my private clinic. And also stands for those people who were already traumatized before the war because of sexual abuse, accidents, attacks, previous wars, which their condition also worsened.
So the general atmosphere in this country, which is it's almost like, as very evolved mammals, would you say that a lot of people who have a history of trauma can kind of sniff it out in the air and it can reawaken trauma?
Yeah,
I mean, it's a very
absolutely.
primal way of describing it.
Absolutely. Um, there's a saying which says, what's not kill you makes you stronger. I find it not so true. Some people manage to do post-traumatic growth, and that sentence might be valid for them. But for most people, previous traumas makes you weaker, not stronger, and more prone to the consequence of later trauma.
Hmm.
So we meet many people who were traumatized before, and their condition is not so good these days because of the events and the atmosphere of nothing is really sure, nothing is really well held. I think many people feel that there's no responsible adults in the country these days.
Hmm. And so therapists like you kind of have to step into those shoes. And I guess in a way, you're probably carrying a heavier burden than ever before, I imagine.
Yeah, I would agree.
Tell me, what is the ideal? I mean, of course, there is no ideal treatment program because every person is so different and the trauma is very different. But if you could kind of think about the ideal governmental and treatment framework for people who either civilians or combatants who come back with trauma, what would that be? What is the first or several first most important things that these people need?
It sounds like a simple question, but it's really not. Even though people are fighting and killing each other for thousands of years, we still know very little about what's the most effective way to treat post-traumatic casualties.
Mm.
What's supposed to be so well known after so many wars and so many years of fighting, it is still a good question. And I think the most intriguing question is, what do we do with recent trauma? How do we treat people who met trauma in the last few hours and last few days? What could prevent them from deteriorating further? And it's an open question. We don't really know how to treat them pharmaceutically or therapeutically in conversations. So we try many things, and there's no agreed protocol. I think most people would say that you have to differentiate between what's happening in the first few weeks and people who are suffering from a chronic episode, which is after a few months.
Mm.
And we are already almost a year in this war, so we can see people who are going to suffer from this consequence for a long time, with disabilities and impairment of their private and occupational and family life. And people who have some more acute episode, and maybe we can help them not going the full path to chronic PTSD. I think our goal is to give it validation, to be a supportive net for their needs, to say the obvious that they've went through things that are extreme and not normal to experience, and to explain how the soul tries to organize itself in order to heal. So Israel has a unique experience in treating trauma, and we have all those kinds of protocols to treat trauma. I think basically you have to just be there and allow the person to go through his trauma in a safe environment in which he can feel held, understood, and welcomed.
Hmm.
Afterwards, we're trying to treat the more chronic consequences, and here we have to engage with the community. Sometimes people need to be for a period in institutions like we have here, which is a daycare unit. And some people lately are also being benefited by psychedelic therapy.
Hmm.
And I think it's worth to say that the traditional therapies for PTSD are not so efficient. So we are always in a search for new therapies. And personally, it's a field that I'm very interested in. So we have suggested few research around trauma, along with OCD and depression and others. But in terms of trauma, we're involved in a MAPS study on trauma on a group setting with MDMA. And also we have two studies on trauma with psilocybin.
Mm-hmm.
And we have an active,
Psilocybin being a active component in mushrooms,
yeah,
psychedelics.
and then we also have an active treatment, which is not research based, but actual going on treatment with ketamine. We give ketamine in an injection, in a muscle injection, and then we have about 2 hours of psychedelic session held by two therapists. We're doing trauma-focused psychotherapy assisted by the effects of ketamine. and we see a very high efficiency of this treatment. We've already treated around 20 clients here. We got a small funding for this, so we're running it in this hospital with no charge for the clients themselves.
I want to go a little bit deeper into these treatment modalities that you're experiencing with. First, I want to go back to what you said about the kind of traditional therapies. So, what's interesting to me is you seem to be on the forefront of all these experiential therapies, such as somatic experiencing and psychedelics. Mindfulness, Buddhism. At the same time, you come from a very mainstream background. You're a psychiatrist, so that's like
Yeah.
prescribing antidepressants, etc. And you're a psychotherapist, which is based on psychoanalysis and Freud and all of that. Um, and I'm interested in why you think that those kinds of therapies don't don't kind of hit the mark. Is it because traditional therapy is really kind of talk based, so you're talking about your trauma, but you're kind of staying within the realm of the rational part of your brain, trying to kind of rationalize it? And is it because that is not enough, taking into consideration the kind of experience that the body has stored in some way? The body has stored the trauma. Is it related to that?
Well, it's hard to say. I think all the things you've mentioned are valid. I can answer this in few ways. First is practically we see that the current therapies are not enough. And if you look at statistics on US war veterans, you see tremendous amounts of suicide and disability.
So those are people who might have been treated traditionally and maybe take antidepressants and anxiety medication and go to kind of therapy. You're saying you're still seeing enormous rates of suicidality.
And disability. And just look at the statistic, you can see it doesn't work. Why it doesn't work? I think trauma touches very, very deep wounds of not being able to trust other people mainly, and also the world. Like if the people who experienced trauma, something shatters inside them in the most basic way, which people believe that the world is a safe place and people are might be good for you. So this is a very, very deep wound. So we need something which is way deeper than words. So I think even traditional psychotherapy, I think the main thing that traditional psychotherapy does is not about the words itself. It's about the connection, it's about the emotion, it's about something that is happening which is beyond words, and the words themselves are just the camouflage of what's actually happening.
Right, which is the connection between the therapist and the
Yeah, but I think
patient.
in order to do this well, you need to be a very wise and experienced and talented therapists. As in all fields, only few or not a lot of the therapists manage to do this kind of work. Also, I think many therapists don't include the body into the picture.
Mm-hmm.
And trauma is ingrained into your body. And it affects the nervous system, it affects many, many aspects. And almost always, if not always, the body is a very important part of the trauma itself. So we have to acknowledge that. I have in my life those two parallel realms of development. One is I've been an officer in the army. I've learned medicine in Tel Aviv University. I had my full residency in Shelvata, which is a very good psychiatric hospital in Hod HaSharon. I learned psychoanalytic, psychodynamic psychotherapy in Tel Aviv University. My supervisors were people who were interested in dynamic analytical approaches. And in the same time, I have a black belt in martial arts. I I practice Zen since 97.
Zen meditation.
Zen meditation. I teach mindfulness. I'm interested in psychedelics. And so I have also this unconventional side, which I find this synergy give me a lot of opportunities to merge those fields and to be in an influential place, also in the army, but also here in hospital that I manage this department, and then I can bring into the institutional Ministry of Health hospital things like psychedelic therapy and Zen meditation. It's not very usual that I don't think we have another psychiatrist in the hospital who have a Buddha on the wall. Yes, and we also have this outside my window. We have this therapeutic garden, and our clients are working together and cultivating the soil and growing trees and plants and flowers, and we have fish in the pond. So I think moving and doing things and touching things and being mindful to them are therapeutic in themselves, especially in trauma. I think in general, if you do something which encompass all who you are, first of all, it's fun and it helps you to be more engaged. And if it's fun for you and you're engaged, you can bring yourself wholly, and then you can not just enjoy it, but to be beneficial. And I would say the obvious that I'm not doing it alone. I'm doing it with my crew here, which are each unique and special and wonderful people and wise therapists.
I've been in conventional therapy for 20 years and took different kinds of medication. And I can say for myself, for childhood trauma, that they helped to an extent. They helped kind of contain, manage. But I always felt like I was moving through life with kind of like a limb missing. Like maybe to the outside world, it looked like all my limbs were there, but I felt like something wasn't there. I really felt that once my body was included into the healing process, that's really when my kind of invisible limbs started appearing. So I started learning yoga, and then I started learning meditation and different kind of like movements and really connecting with nature. When you talk about the garden and kind of putting your hands in the soil, it's a way of reconnecting and reappearing. And I can really imagine that the trauma survivors who pass through your clinic are probably very, very fortunate, because I feel like you're probably looking at the whole of them, not just their story, not just the narrative, but also at the very, very deep needs in their bodies to reconnect, to feel safe, to be held, to be seen. What are the things that you do in order to maintain your own resilience? And are there moments where you start to feel like you're fraying at the edges?
Well, I think the last year was very challenging. But I have this regular Zazen practice, which is Zen meditation, which I sit regularly, and I think it's really saving me. Gives me kind of everyday stopping to recalibrate.
What do you do during the Zen meditation?
Nothing.
Is it just focusing on breath?
No, Zen meditation is about, it is sometimes called the art of doing nothing. So in contrast to many other meditations in which you have objects like focusing on breath or on noises or on sensations, in Zen meditation, classically, you just being aware of what is with what is called choiceless awareness. And you bring your attention not to the contents of what's happening in your consciousness, but just to consciousness itself. It sounds a little vague, but normally we are focused on thought's content. Zen Master Dogen, which is the greatest Japanese Zen master ever in the 13th century, he calls it to take the backward step. It's like taking a step backwards for all the occupation of the mind with things. And how does it feel not to be busy with things, but just with awareness itself?
Mm.
So it needs some practice, not a lot to understand the technique, and then it's just sitting. In a way, it's the most simple and maybe the most challenging meditation.
Yeah, I can imagine why it would be so challenging because you don't have an anchor, you don't have something to
Yeah.
focus on.
So I do meditation. I also trying to be aware of my body. So I move. When I go home, I have my garden. So there's a lot of work. I'm building things in wood, and I'm treating the garden, and I have my kids to play soccer with and to wrestle with, and I have my friends. They all been very supportive in the last year and going with me with like a big hug. And I have my teachers, which are also like a lighthouse of hope and wisdom and kind of build my inner structures.
Mm. Sounds like you're very blessed to have a very whole support system that you've created for yourself, which probably allows you to give so much more.
It's important. Yeah, it's important for me.
Let's go back a little bit to your work in the army. You're working with soldiers, so most of them are young. What are they seeing? What are they experiencing? And what aspects of it can be so traumatic? Is it violence inflicted by others, or is it violence inflicted by them?
Hmm. It's a very important question. I think the obvious way we think about trauma is about people who were exposed to things done to them. And that's, of course, valid. And many soldiers seen too much, were frightened by circumstances that were life threatening and scary and horrible. So that's one part of trauma, and maybe even the more common type of trauma. But there's also in the literature, and we see it more and more often in the field, which is called moral injury. That people are being traumatized by doing immoral actions to others or being exposed to such circumstances. And unfortunately, we see those as well. And that's difficult for the soldiers, but it's also difficult to treat
Mm.
for the therapists because it's a heavy burden. Because you see someone who's both a victim and a victimizing. And I think it's a more complicated and difficult to treat. And it's also sad for me personally to be exposed to it.
Mm. Is it something that you think in this current war has more opportunities to kind of, sprout moral injuries? Is it because of the scale of the war? Is it something that you feel has more outlets specific to
Yeah.
this war?
I definitely think it's not new. I think it's always been an issue. But I think the scale of it raised in the current war. First, because the scale of the war. Secondly, because this war began with a tremendous amount of hatred and with a revengeful energy.
Mm.
Um, and also, it keeps on going for a long, long time. The Yom Kippur War, which is one of the biggest tragedies of Israel, fighting itself lasts less than 2 weeks. And here we are almost counting a year. So people have more and more opportunity. And also, I'm tempted to say normal wars as if there's such a thing, but there's no such a thing. But here, especially, there's a very, very close connection between civilians and soldiers. The big previous wars, it was a war between soldiers. So it makes a huge difference.
Do you ever feel morally torn about
Absolutely.
In the army, you're still participating in some ways in this machinery of war. I imagine that as a, a Zen practitioner, as a meditation teacher, you must in some very deep way be a pacifist. How does that blend
It,
in with your past as a soldier and with your work in the
it
army?
is difficult, In a way, it's easier for me because I'm working as a doctor, and I'm in the side of the victims. But that's a too easy answer. Okay, in a way, it's always a question how right it is to be part of the war and representing this army as a major, as an officer. I think my ethical calculations, um, I try to navigate between those ethics. And as any ethical conversation, there are downsides and pro sides. Until now, I think the work I'm doing for the victims is more important than to say I'm not collaborating. But it's a concern.
You have two sons. How old are they?
My older son is 15 and a half, and my younger one is 12.
And when you think about them going to the army, how do you feel?
In a way, I'm thankful that my kids are still young, but they're growing up. And I'm terrified by the fact that they're going to be exposed to things I was exposed to. My army service as a combat soldier and officer, I think it was good for me and taught me a lot and was important to my personal growth, but could very easily would be traumatic.
Hmm.
And in the most simple way, I just, I love them, so I'm afraid that something will happen to them. And I'm also not always trust the leadership that will be wise enough to care for their lives. So it's a concern, but I don't think it's a different concern from any father in this country,
Hmm.
father or mother.
Yeah. I have an almost 9-year-old, and I keep telling my husband they're very fortunate that they have several passports. And I'm from Belgium. My husband's from the United States, and we always argue about how much we are willing to sacrifice. Until when are we willing to stay and sacrifice? And it's a theoretical question because we both care deeply about this place and we want to be here. But I always tell him I give you, as if he's in charge of this country, I give you 5 years. If in 5 years things are still, if I still don't trust the leadership, thinking about my son is makes it all so real, and it's time sensitive, it's time related. It is such a peculiar thing that I think I'm not sure there's any other country like Israel that has to kind of think in the same ways. I always ask my guests this: do you ever have kind of like secret dreams of escaping this place? Is there somewhere that you think would be all zen and peaceful?
Well, of course, I have these dreams. I also love this country. My friends are here, my family. Um, Hebrew is very ingrained into my thinking and soul. But there are many other beautiful places in Kama. My sister lives in the UK. Laura, the mother of our kids, she's British. So my kids also hold a British passport, and they have a very big and nice family there. So it's always an option. It's a good question. Kyoto is beautiful.
I didn't mean to plant the seed of escapism. It's just a thought exercise. It's not meant
Yeah,
to.
yeah,
Yeah,
yeah.
yeah, yeah, yeah. I think this country needs you.
I think you're going to find very few people that don't have these dreams somewhere.
Yeah, I think it's important on some level to be able to imagine being in a place or at a time that feels beautiful and joyful and safe. And that's also something I keep coming back to on this podcast, is that I think a lot of people feel a lot of guilt when they either travel, but it can just be when they enjoy, when they have family dinners or dinners with friends and they laugh and they dance or they do yoga. And I think dreaming of escaping or being in a place where we would have, that feeling of joy and safety is actually very important. Just in the same way that you find all these support networks that allow you to do what you do, I think all of us have to fill our buckets to the extent that we can in order to be able to be there for others or for ourselves, you
Yeah.
know. Tell me more about psychedelics, about all these kind of ketamine, MDMA, psilocybin. First of all, how much experience do you personally have with them? And tell me about it, just because I'm very curious. I'm interested myself. But what do you think it is about them that have these healing aspects?
So, yeah, personally, my research interest in psychedelics is not entirely theoretical. So I have quite a lot of experience with psychedelics since I was very young. Psychedelics were like a company to my life in the last at least 2 decades, and escorted my professional development and psychotherapeutic development and my personal development and many, many other things. And I'm very happy for the opportunity to bring it into the institutions and to do it in a responsible, safe, and legal way. And that's a huge benefit of being a psychiatrist in a governmental owned hospital, and to live in this era in which psychedelic has its what is called renaissance. For me, psychedelics always were able to be a mesh of three different fields: my psychological stories, my spiritual life, and my body experience. So it gives something which is very holistic in these three aspects. And if you do it in a therapeutic way, which is held and safe by experienced people and good-hearted people with good intentions, it can be great help to many things, many formal disturbances, as well as just for personal growth. It's very different from doing it in a party or for recreationally. And I think psychiatry these days is not in a very good place. For the last few decades, there were no real new therapies in psychiatry. And the medicine we use are not very good, not very efficient, and they have terrible side effects. So we are always in search for new therapies which will be less chronic and more efficient and with less side effects. So I think the search into psychedelics is part of that. And I think research shows that this combination has a unique synergy of being with less defenses, which enables you to be more talkative and more open to psychotherapy. So things really gets moving way faster on one hand. And on the other hand, it has this neurophysiological aspects, which is related to greater brain connectivity and plasticity. It actually changes the shape of your wiring,
Hmm.
if
Of your brain, yeah.
put very simply and simplistically. So it also helped change from things that were wired by trauma and depression and anxiety, to change the brain's wiring to something which is more trusting and healthy and loving. So this combination, this synergy between neurophysiology and a therapeutic effect of psychotherapy I believe has a tremendous effect on various disturbances. I I need to say as a doctor, in order to be responsible, that psychedelics can also be dangerous. So in order for it to be safe, we put a lot of effort into screening and to see whose people can benefit from it and who might be hurt from it. So it's not just to promote psychedelics to be put in water for everyone.
Hmm. In fact, um, at the Nova Festival on October 7th, a lot of people were on psychedelics, on mind altering drugs. And from some of the things that I read, in some cases, they actually exacerbated the trauma. Can you talk a little bit about that?
Well, there are research done these days. One of them is Professor Roy Solomon and others who are trying to look into the effect of being under psychedelic effects during the trauma. I think the picture is very complicated. Some, I think, benefited from it. Some, I think, it exacerbated the trauma. Um, as a community, the Nova survivors are a complicated group, and some of them suffer tremendously until these days, and are a group which is not so easy to treat and has its unique challenges. So I think it is still unclear whether the use of psychedelic was protective or even dangerous. And I also think it's not such a yes or no question. You know, people used various kinds of psychedelics in different times, so it might be different if you just took the psychedelic, if you took acid an hour ago, or you took MDMA 5 hours ago. So it varies a lot.
In your work, do you also treat civilians who were directly affected by the October 7th attacks?
Yeah,
Or
absolutely. We have clients in this ward, and in my private clinic. So it's all over. You can't escape it as a therapist.
Hmm. And do you find that the community of healthcare providers, of mental health care providers, therapists across the country, has there been a kind of support system there also where you share with each other? And because
Mm.
this is really a situation where you've had to learn as you go along because nothing like this has ever happened. Do you feel there is an understanding on the part of those in power? You know, you said before that we're kind of, in a way, we're on our own, that the leaders aren't displaying a lot of responsible, um, emotionally intelligent leadership. But is there a general understanding on the part of the Ministry of Health and on the part of those in power of the scale of the wounding, of the psychological wounding of soldiers, of the general population? Or do you think there's a very big gap between what you see and what is being understood at those levels?
Well, I think there are many good people who are very well intentioned that are trying to find solution to that. On the other hand, mental health in Israel was neglected for decades. And we are in huge gaps in a need for psychologists and social workers and psychiatrists, and that's a consequence of years of neglection. And now the country is in need, and it's difficult to recruit so many people so fast to work in the Ministry of Health that pays really little and not enough to therapists. So that's a challenge. On the other hand, I see the initiative and I see very good and wise people trying to find solutions. And I think we are not yet exposed to the scale of the impact of this war on civilians. I think it is yet to come.
Mm,
Maybe, I don't really know why, but we don't see the massive amounts of people arriving to the hospitals yet.
mm.
But I'm almost sure it is going to arrive.
Yeah.
Maybe because the war is still going on, maybe because of the political circumstances. I don't really know. Maybe we need more time.
Yeah. I think, maybe one hypothesis is that, the people who were most affected, and there's so many in this country, and so many of us know them, either people who were killed or injured or who are currently serving. When you see those people, I think it might be hard for a lot of civilians to say, I need help.
Yeah,
People who live in Tel Aviv and just have been watching the news for a year,
yeah,
and who know there is a lack of mental health practitioners, etc. And I also think that in time of war, maybe a lot of us are kind of like holding, kind of like tensing our bodies, our muscles, and it's still
waiting.
in that state of fight flight where we haven't let go enough to kind of see where the deck of cards have fallen psychologically, and to understand what are the implications for our
Yeah,
own mental health.
yeah.
What are things that you think people, average civilians, should do if they could all hear you and you had a message for them? What would you say?
Well, I think if you suffer from symptoms of post-trauma, I think you should seek therapy. That's first. But also, I would encourage people to put attention on their resources, paying attention to the body, like doing meditation, yoga, any kind of sport. Connect or reconnect with your friends and community. Be around people that you love and love you. Try to be engaged in something which is creative. And I think maybe most important, um, try to remember what are your most important values as a human being. And I think doing something according to these values might be very helpful. Doing something for someone else, building something for someone else, connecting, trying to take your mind out of obsessive thinking about what can I gain to how can I give something to someone. I think that will open realms of compassion, of love, and goodness that is also in great need, but also might help people see the world more clearly and have a spiritual meaning to their existence. So I really believe this is helpful for each people to their own difficulties, not only for others. Like I recall what the Dalai Lama said. He said, if you want to be good to others, practice compassion. If you want to be good to yourself, practice compassion. So I think giving and generosity and kindness are great medications that maybe we don't take enough.
Thank you so much for taking the time.
Thank you for inviting me. It was very nice to speak with you.
It was a pleasure, Oded. Thank you for listening. This has been Raw. To listen to more of our episodes, you can find us on Spotify, Apple Podcasts, or wherever you find your podcasts. I'm Anouk Glory. Goodbye.